In this episode of the Nurse Practitioner Podcast, 2020 Author of the Year Award winner Dr. Renee Poza discusses hepatitis C. How does someone receive a diagnosis of hepatitis C, and who should be screened?
Often someone with hepatitis C presents with very few symptoms. It is typically an asymptomatic disease. Therefore, the importance of screening cannot be underestimated. Previously, we screened individuals for hepatitis C related to risk factor assessment and then birth cohort assessment. In other words, in the individuals that were born between 1945 to 1965 were at a higher risk of having hepatitis C, and it was recommended that those individuals receive a one-time screening. Most recently, the latest recommendations for screening are a universal screening of any individual who's over 18 years of age. So how do you screen for hepatitis C? There's really two tests that you want to look for. First is a hepatitis C antibody test, and this will give you a result of positive or negative. A positive result indicates an individual who is either currently infected or has had past infection. So that's the hepatitis C antibody test. That can be done through a lab test that you order and send a patient to the lab, or there's also some more recent approved point of care testing, which can be done in your community clinics and offer a more rapid response in a result for you. For individuals that test antibody positive, you then want to go to a hepatitis C viral load, usually done through a PCR analysis, an assay, again, done by a lab test or a point of care test, and it's looking for viral load, so viral replication. Interestingly, the viral load quantitative number does not correlate or indicate disease severity. So the actual number of viral replication is not necessarily as important as what it's telling you is that this is an individual that has an active infection.
Once chronic infection is identified, what are the next steps?
Once you have identified a patient with hepatitis C infection, the important thing is to link them to care. So determining how they can access care, where they can access care, and really starting to discuss treatment options with them is really important. The second thing that's important to identify in the patients is their underlying liver damage. So many individuals, because of the asymptomatic nature of the disease, have lived with this infection for years. And so the determination needs to be made of, do they have a mild liver damage, or are they in more of a late stage and have more end organ damage, which we would call cirrhosis. And that will influence your planning for treatment for them.
What are the factors to consider for someone seeking treatment advice?
You really want to remove the barriers to receiving medications or treatment for these patients. So looking at whether that's an insurance status issue, some payers have checklists or certain criteria for medication. And so looking at, does the patient have any barriers to receiving medication? So that might be their underlying liver disease as well, or also evaluating any psychosocial issues such as substance abuse or other mental health issues that should be identified and treated along with the hepatitis C treatment.
What tests should be ordered to evaluate underlying liver damage?
Previously, we used a lot of liver biopsy to determine stage of liver disease and underlying liver damage. However, more recently, in the last few years, there's been much more approved non-invasive ways to evaluate liver fibrosis or scarring. So certainly you can do some lab work with non-direct and indirect markers, which help you assess for underlying liver fibrosis. The most commonly commercially available ones are called the FIB-4, the APRI, and the FibroSure. These will all give you estimates of liver fibrosis and underlying liver damage. They are more sensitive and specific for the opposite ends of the spectrum in liver fibrosis. In other words, those individuals that have very minimal or mild liver fibrosis and those individuals that have much more advanced stages of liver fibrosis. So those individuals that are on the spectrum of into bridging fibrosis and cirrhosis. So these lab tests can be very helpful to identify those individuals that have more advanced liver disease. Certainly other lab values are helpful in looking at other underlying causes of liver disease, such as hepatitis B an HIV infection. So a lab panel to look at some of those other markers would be important as well. And then finally, you have some imaging tests that are usually helpful. And that could be either an ultrasound, a CAT scan, a triphasic CT, or an MRI. And really with these, you are looking to assess for the potential of a hepatocellular carcinoma. Those individuals that have cirrhosis, whether compensated or decompensated cirrhosis, are at risk for developing a liver cancer or hepatocellular carcinoma. And so imaging is certainly important in those individuals. Another more recent way to assess for fibrosis is using transient elastography. More commonly, the model of machine that we use is called a FibroScan. This can be very helpful in assessing for fibrosis as well as for the degree of steatosis in the liver. So these machines need a technician or often a nurse practitioner to be trained to use them with the accuracy. The more the user of the machine has experience with it, probably the greater accuracy in the test results for these FibroScan. But it's a very nice, non-invasive way to give you a quick assessment for underlying liver damage. The machine will actually calculate 2 scores for you in this part of the software program. It's done through a shear wave stiffness measure, and it will measure the degree of fibrosis as well as degree of fat or steatosis in the liver. And it's very useful with patients in describing some of the underlying pathology that's going on in the liver.
Is there a role for the liver biopsy anymore?
We really only use liver biopsy now in rare cases. And it's mostly to evaluate other causes of liver disease or liver damage. And so this is one of the areas where I think a nurse practitioner can be extremely helpful because patients oftentimes will seek information on the internet and search for answers to their questions. And previously, there have been patients that are extremely nervous of feeling like, a needle and a liver biopsy and making them reluctant to seek treatment options because of this. So reassure patients that it's really only in rare cases where we would order or need to order a liver biopsy at this point. Along those lines, those individuals also see other information on the internet about our older medication treatment and some of the side effects that were associated with that. So the role of the nurse practitioner here is really important in patient education and reassuring patients what the current treatment regimen looks like.
What medications are used in hepatitis C therapy, and how successful are they?
The medications that we use in hepatitis C treatment are called direct-acting antivirals. They were developed many years ago and are really targeted therapy directly inhibiting viral replication of the hepatitis C virus. They have very minimal side effects, and they are all oral medications now with effectiveness at over 95% cure rates. The treatment regimens really contain of 2 main medications which have combination drugs in them. Again, like I mentioned, they're an oral tablet with either a protease inhibitor, an NS5A or NS5B inhibitor, all with the mechanism of action targeting different areas of the virus that are responsible for viral replication. The drugs are very effective and have a treatment length of either an 8-week regimen or a 12-week regimen, depending on the type of medication you would choose. And there is a third option for patients in the rare instance that they either relapsed or were unsuccessful on previous therapy. There is an option with 3 different drugs in the tablet that we reserve for those patients that have been very difficult to treat. But luckily, it's really become much more simple with shorter courses of medications that are needed for these patients to achieve a cure rate. So how do we define cure? Cure is really what we call a sustained virologic response, or an SVR, and this is usually identified by a viral load of negative 12 weeks after the patient has stopped taking their course of medication. So importance of screening and identification up front, linking them to care, choosing your treatment regimen, monitoring them while they're on their treatment regimen, and then testing for viral activity through the viral load by PCR 12 weeks after they've stopped their therapy. If at that point they're negative, that is their assurance of that they've achieved a cure of their hepatitis C infection.
What type of monitoring should one receive during hepatitis C treatment?
This is where I feel the role of the nurse practitioner is a perfect one to monitor patients, not only to help them have access to receive medications, but to monitor while they're taking their hepatitis C treatment. Because of the limited side effects of these medications and the really simplified treatment regimen and laboratory tests that you need to do, this is perfect for a nurse or a nurse practitioner to monitor these patients on treatment. In February of this year, the hepatitis C guidance provided an update with recommendations to use this simplified treatment monitoring while patients are on therapy. Really, the goal of monitoring is looking at some laboratory tests, but also patient education and adherence to their medications. There are some interesting care models out there being evaluated of phone calls made by nurses or nurse practitioners to patients. Telehealth now is a great option for patients that are on treatment. So no longer is it the intensive bring them into the office, do a lot of laboratory panels, and see them frequently like we used to with the older treatment regimens. So most of the providers are recommending a somewhat modified and simplified treatment monitoring for these patients.
Are there patients that nurse practitioners should refer to liver transplant centers and/or a hepatology specialist?
There are two main groups of patients that really need to be seen by a specialist. Certainly you can consult with a specialist at any time. If you're new to treating hepatitis C or just want some reassurance, there are different mechanisms to do this. Project ECHO is a good example of that, where primary care providers can access specialty care to help them with reassurance and questions related to patients and the treatment regimen. But those individuals that have cirrhosis are someone that I would consider needing hepatology specialty. Cirrhosis is end organ liver disease and is a risk factor for the development of hepatocellular carcinoma and is classified in two main areas. Compensated cirrhosis, and individuals can live for years in the state of compensated cirrhosis. Or then what you're trying to prevent is a decompensated cirrhosis. These are those patients that have evidence of ascites, thrombocytopenia with low platelets, or hepatic encephalopathy. So all of the signs and symptoms that your patient has much more complications of advanced liver disease. These patients are also at risk for developing liver cancer and hepatocellular carcinoma. And so these patients, in any patient that you would identify a liver lesion on imaging, that is someone you also want to send to the liver transplant center and or hepatology specialist. In these patients with decompensated cirrhosis or a liver cancer, timing of hepatitis C treatment is very important and an issue to seek guidance on. As those individuals that are waiting for liver transplantation, the timing of hepatitis C therapy may be delayed until after transplantation in order to have a better outcome for those patients.
What type of long-term care does someone need after hepatitis C treatment?
Hepatitis C treatment is a goal of viral eradication and curing the viral infection for patients. However, it's important to remember that they need somewhat of an ongoing assessment of liver damage. We do know that cirrhosis and liver fibrosis can reverse over time. It may take many years, but the assessment of this would be important to evaluate in these patients. Doesn't necessarily need to be done in the setting of a hepatology practice. Primary care providers, nurse practitioners that are working in that setting, especially with these non-invasive markers that I mentioned previously, but some sort of assessment of their underlying liver damage, and then assessment of risk behaviors. It's important to remember that after hepatitis C treatment and a cure does not mean that a patient cannot get reinfected with hepatitis C. So there's no immunity associated with the treatment. And patients, if they continue in risk behaviors where they had exposure to the hepatitis C virus, they can reinfect themselves. And so this is also an important role of the nurse practitioner to assess for this and work with those patients to decrease their risk of getting reinfected.
What do you see as the role of the nurse practitioner in caring for individuals with hepatitis C?
As I mentioned before, I think the nurse practitioner's role is the perfect person to provide care for individuals with hepatitis C. And depending on the setting that the nurse practitioner works in, they may have a different role or variety of roles in care of these patients. Certainly the importance of screening and diagnosis of these patients is critical in linking them to care and access to treatment. While we've had extreme advances in the science in hepatitis C treatment and the new medications, we've also unfortunately seen an increase of incidence in hepatitis C infection. It's nearly almost 4 times as much from 2010 to 2017. Most of that we feel was driven by the increased injection drug use related to the opioid epidemic. So I can't underestimate the importance of screening and identifying patients who are infected. And then certainly the treatment monitoring and patient education and long-term follow-up. So those individuals that develop an expertise in treatment of hepatitis C and work with these patients in a long-term follow-up, that's also an important role of the nurse practitioner.
Do you have any advice for a nurse or nurse practitioner who would like to enter the specialty?
Get yourself involved in care of these patients. They're a fun group of patients to work with, and I think it really provides a way for nurses and nurse practitioners to learn more about the disease, but also learn more about the holistic approach to care of these patients. The World Health Organization has set a health priority of global eradication of hepatitis C infection by 2030. So each nurse practitioner and advanced practice provider is really needed to help us reach this goal. There are lots of resources out there to educate yourself around hepatitis C treatment and some of the nuances in care of these patients. The American Association of the Study of Liver Diseases is a great resource. They offer practical educational resources. The article that we wrote in this journal is a good starting place for you to get involved in and familiar with care of these, some of the needs of care of these patients. And then look for a mentor. Many nurse practitioners or PAs that are working in this area, in this specialty, you can find them in community clinics, you can find them in primary care offices, but more often you'll find them associated with a transplant center, either in a hepatology practice, maybe gastroenterology or infectious disease. But I have found all of the APPs that are working in this area are really helpful and willing to provide mentorship and guidance to you as you're interested in entering the specialty area.
This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer.